Okay, if we look at the sternoclavicular joint now, can you lay back for me? We have here a sellar joint. It's an unmodified sellar joint, and it's got 2 degrees of freedom: elevation, depression, protraction and retraction. And as at the other end, because the capsule is so lax and there's a thick meniscus, it allows the clavicular spin. So in order to test these movements out, we can test the roll of the clavicle simply by laterally rotating the arm into this position and using the arm as a lever. And I'll flex the humerus across the body, palpating as I do so the sternal notch and the medial end of the clavicle. And I simply roll it across like so, looking for it to move. And in fact, what I'm picking up with Nora is a click as I do it. So there's an indication that there's an articular instability or possibly a slight meniscal derangement. To test the other roll, I'll immediately rotate the arm here and same palpation point and roll it towards me like so. So I can feel that clavicle rolling. To test distraction for the actual joint capsule and looking at the spins, I will test it by walking around to the other side of the bed and then testing on the opposite side. So I'll stabilise the manubrium, gentle stabilisation, nothing too strong, and palpate the medial end of the clavicle with my index finger. And then grasping the lateral end of the clavicle, I simply just pull it laterally, and I can feel the clavicle moving away from the manubrium. Now this test is particularly sensitive for arthritic conditions, and it will really very much help you to rule out muscle as a cause of the hypomobility. We can test the other glides as well here, and we can test an anterior glide and a posterior glide. Slight stabilisation on the manubrium, and all I'm going to do is push this posteromedial and pull it anterolateral, the clavicle. So I'll test its ability to glide forwards and backwards. And the superior inferior glides are not particularly comfortable, and the patient usually won't let you do them, and you really don't gain an awful lot more information out of doing these tests. To stress test the joint capsule, we'll do the same position and the same glide, except again, instead of going along the plane of the joint, we'll go directly anteriorly and posteriorly. But be careful while you're doing these. These joint capsules are not particularly strong to these movements. So just very gently pull it forwards and back as you strongly stabilise the manubrium, and there should be very little, if any, movement occurring there at all. Treatment for this joint is the same as for mobility testing. We can go for pain relief by doing very, very gentle traction, or by increasing the traction and increasing the stability on the manubrium, we can produce very strong traction to stretch the joint capsule. Similarly, if the glides are restricted, then I can come in and basically produce the anterior or posterior glide, depending on which one is restricted. There are the osteopathic techniques for muscle dysfunctions, but in fact, if you've been treating this properly and you've basically ruled out the neck as a cause of problems in the shoulder girdle, then any myofascial restriction should have disappeared as you've been treating the other joints and the spine. But the more common technique to use for the clavicle now, this is really to regain clavicular movement and is not specific to any one joint. The usual technique to use first will be to drop the shoulder girdle back, like so, and you simply palpate for when the clavicle starts to move, and then you do a hold relax technique by don't let me move you. And it's very, very gentle pressure, and actually relaxes. You simply take the shoulder or the humerus further back into extension until you feel the clavicle start to move again, and then repeat this until you get no further differential movement between the humerus and the clavicle. That is, as soon as you start moving the humerus, you feel the clavicle move. And this technique, combined with the articular techniques we've looked at, will clear up almost all of the AC and SC joint hypomobilities.